Good morning. Our distinguished speaker this morning is no stranger to the importance of equity in healthcare. In 2003, Senator Daschle introduced the Healthcare Equity and Accountability Act, the first major legislation directly addressing health equity and the elimination of racial and ethnic health disparities. In fact, several provisions from this bill will later be incorporated into the landmark Affordable Care Act. During his tenure as a public servant, Senator Tom Daschle navigated the Senate through some of its most historic economic and national security challenges. He is now a senior policy advisor at the LA Piper's Government Affairs Practice and serves as a senior advisor to the Global Board. He provides his clients with strategic public policy guidance as a wide range of international and economic policies, and I am personally honored to say that I serve as an advisor on the advisory board of the Alliance for Connected Care, which was founded by Senator Daschle. Senator Daschle, it is our honor and pleasure to have you here this morning.
Well, thank you very much for the kind introduction, and thank you for your warm reception. And my apologies for not being able to be with you yesterday. I understand you had a very good conference, a good discussion, and had an opportunity to bring people together to talk about just how we might coordinate our efforts even more effectively going forward. And so I salute you for that and appreciate very much the work that each of you are doing. I should introduce, I'm sure you all know her by now, but Krista Drobeck works with me, and I'm very pleased that she could be here too. I'm troubled, frankly, by the current state of our healthcare in this country. The Lancet study that came out last May, I think, is another indication, another reminder of the challenges we face with regard to maternal health in particular. Maternal mortality rates right now are the worst they've been in 25 years. And that's troubling when you think about the fact that a baby born in Saudi Arabia or in China has a better chance of living statistically than a baby born in the United States. And when you think of the implications of not only maternal health, but health across the board, regardless of the category, chronic illness management, access to good care under acute conditions. I mean, there are so many factors one can judge. And as we assess our circumstances in the year 2014, one can't help but think that in this rich, powerful nation, we spend too much, get too little, and need to do so much more to coordinate our care more effectively, to bring about better value. And that's really what you're doing. And that's why I applaud you. You've decided that there are practical things, there are things that organizations like yours can do, especially to help the underserved. And I salute you for your efforts and the progress you're making doing them. What we've done with the Alliance for Connected Care is to say, look, there are sort of two sides to the coin, frankly. There's the side that you're taking, which is the practical approach to empowering people to do a better job in addressing these awful statistics that we face every day in healthcare. The other side of the coin is to say, well, we also have to do something about the environment, the regulatory environment, the legal environment, because we're way behind the times. The last time we actually passed a law of consequence dealing with health IT, for example, was 15 years ago, when phones were phones, not computers. And so there's a lot of work we can do. And in some ways, this is the most transformational time in all of history for health. When you look at what big data is capable of providing, and when you look at the health IT applications of big data with electronic health records and wearable devices like I have, and all of the things that we're now able to do, there's little question in my mind that if we seize this moment effectively, that there's an unlimited potential for improving the lives of all Americans and dealing with those terrible statistics in a much more effective way. And that's really what I'm hopeful that we can do. I think health IT is really one of those transformational catalytic forces in our country today that could bring about real change. It will help us address the doctor shortage. It will help us address the health settings under which people can get care today. There's no reason why much more of the care can't be provided right from home. But with telehealth and telemedicine opportunities, that will be possible only if we can change the regulatory and the statutory environments. So we have our work cut out for us. But I think as we consider that work and as we consider just how we might work even more closely together, it's opportunities like this that will give us the confidence that we're not missing something, that something isn't falling through the cracks. And so I really look forward to it. I like to tell audiences who care as deeply about health as everyone in this room does, there are really 5 things that are essential to our success. The first is resiliency. If we're not resilient and we face the setbacks and the stumbles that we know are going to come, if we don't get up and dust ourselves off after having not quite reached that level of success that we wanted, we're not going to get there. We have to be resilient. We have to know we're going to have troubles and challenges and that we're going to have obstacles that are going to be difficult to overcome. But resiliency and tenacity in that resiliency is so critical. The second is innovation. You know, I think it's so important for all of us to recognize what a incredibly innovative moment this is, with all the new applications coming on to help us address some of these challenges, unlike anything we've ever had before. And health IT might be at the very top of the list in terms of the potential that it can bring through innovation to address these challenges more effectively. The third is collaboration. The one thing that troubles me a lot about our healthcare sector in this society is that we are so siloed. We really don't coordinate and communicate nearly as effectively as we should. So the more we can tear those silos down, the more we can work together, you with Connected Care, the more I think we can make a big difference. John Breaux and Trent Lott, 2 former senators, and I have the good fortune to chair the Alliance for Connected Care. And we need allies. We need partners. We need people to reach out to amplify. And the only way that's going to happen is if we coordinate more effectively. The fourth is one that's obvious, I think, and that's engagement. We really have to be engaged at all levels, at the policy level, but certainly on the street and in the community level as well. And you've demonstrated the power of engagement with what you've done and how well you've done it. We hope we can demonstrate a similar engagement and success through engagement with policy and regulatory matters as well. And then the final issue is leadership. I think that it's really critical for us, especially now, to show real leadership. I think that in part is what your conference was about yesterday, is asking yourselves collectively and individually, just how do we apply our leadership capacity to the challenges we're facing and give others the kind of direction that this effort's going to take. And so I applaud you for that as well. I have many mentors and many heroes in life, and one of them is Nelson Mandela for all kinds of reasons. But he used to admonish those who followed him to remember that, and he was talking about apartheid for the most part, but he used to tell them that many things seem impossible until they're done. And I've often looked at what we face in challenges in health today as impossible almost. But we can overcome them, and they too will one day be done. If we can apply those qualities, if we can continue to work together, and if we can continue to demonstrate the extraordinary capacity that we know we have in doing so, to make those statistics go on forever. But thank you very much for giving me the chance to be with you, and I'd be happy to have a conversation with each of you and any questions that you might like to ask about what we're doing. Thank you.
Thank you.
Yes.
So, Senator Daschle, thank you very much for your support, and thank you for being with us here with this group of engaged members of NHIT and collaborators. And on behalf of NHIT, and I sit on as a council member of NHIT, I want to express to you our solidarity with your efforts at the national level, and let you know that this organization and all of its collaborating partners are here to forge that alliance and that collaborative network with you and your activities, because you talked about the 5 components, and leadership is very critical, and the leadership that you're taking nationally, and I know that it's a leadership that extends internationally to promote telehealth and health equity is something that we want to support, and we want to bring our collective wisdom, experience, projects, humble efforts to illustrate, to magnify, to amplify, as you well said. So having said that, how can we help, number one? Number two, what is the state of your efforts in overcoming the barriers to allow a freer telehealth system environment where healthcare access can be made available to individuals wherever they are and wherever they need to have that access to care?
Well, that's a great question, and I will certainly invite Krista to add to anything I say, because she's been our executive director and the person who has really orchestrated the effort. First of all, let me say, I think the most important thing we can do is, and this is not meant to be a criticism of anybody, but I think we really need to work in a even more collaborative fashion than what we have in the past. I think that we can enhance our capacity in both organizational efforts by doing this in a much more collaborative way, and I'm hopeful that we can demonstrate greater collaboration going forward. I also think we have to do a better job of convincing people that we can address the 3 major challenges we face in health, which is cost, access, and quality. People continue to be concerned about the increases in cost, even though they have leveled off a little bit in recent years. We certainly have problems with access, especially for the underserved, and I think that it's critical for us to say, you know what, we have a real solution to access and to cost, and even quality, through telehealth and telemedicine and health IT. And we can prove that. We just did a literature review a couple of months ago where we basically, in a very organized, professional way, Googled everything out there just to find out just what does the literature say about those 3 things, and what can we say with some degree of confidence and authority about our ability to answer those challenges more effectively. And I am very impressed with the information that was generated and the reception that information had. We had 2 meetings on Capitol Hill to release it, and members of Congress were extremely interested on both sides of the aisle, and I'm very encouraged by that. The next thing we have to do, there is a perception that telehealth could actually increase costs because of higher utilization, and I understand that. But we're able, I think, over time, to demonstrate that there's little doubt that we can dramatically bring down costs, and we'll be able to show that just as we've shown with the literature review. That's going to take some time, and we have to convince the government authorities. We can assert it all we want, but we have to get them to believe it too, and that will be a challenge, but we think we can do that. So that's another obstacle, is to convince them that budgetarily we're actually going to improve circumstances, not exacerbate them. And I'm hopeful that we can do that. Am I not holding it close?
Yeah, that's fine.
Okay.
Thank you.
So that's another step we can take. I think also, as I travel, I'm encouraged by the level of support and the level of interest there is in health IT. But I still think that there's a lot of educating that needs to be done about just how we apply this new technology in the most meaningful way. And so together, I think collaborating, as I have now mentioned a few times, I think there's a real opportunity for us to do a better job to educate. And I hope we can do that together too. Krista, would you add anything?
Sir, I'm Matt Quinn. I'm the Director of Healthcare Initiatives for the FCC. Thank you so
Holding.
much for being here today.
That's
This was a conference, but one of the things that Luis has been really adamant about is that we want this to endure beyond just a day of talking. And one of the action items is to put together an agenda and a plan for how health IT, including telemedicine, can address health disparities.
We always change it after each event, just in
Yeah.
case.
On this conference, and maybe
I know it's
go on to
good,
other-
but
Any thoughts? I'm a firm believer in this, and to build on your comment about how we need to do research, we need to analyze how this can fit into other settings, how to use telemedicine specifically. Any thoughts on areas of focus that should be priorities in this report that you're putting together? And you don't have to list them all now, but certainly between you and Krista, Luis and his organization would really appreciate your input.
Well, I think that's such an important agenda item is to talk about how we might better assist those who today have so little recourse. And I think the exchanges and the Affordable Care Act are beginning to work through the Medicaid expansion, through access to exchanges, creating opportunities for millions of Americans to get insurance for the first time. But what troubles me is we still see a far higher utilization of emergency room care than we should have to in this country. And so I see telehealth as really one of the best opportunities to get better care, not only to reduce emergency care, but to get better care, better quality care, better value at far less cost, in probably a much more intimate setting than what most people face in emergency rooms today. I've had emergency room experiences with my family, and sometimes the waits go forever, and even once you get in, the frustration with paperwork and the extraordinary just questionable quality, I think, of the experience leads me to just strongly believe there's got to be a better way. And I think telehealth is that better way. I have a couple of examples that serve my purpose in enhancing my confidence. One is I'm on the board of two boards. One is called Doctors on Demand, which allows somebody to literally connect via computer with a doctor almost instantaneously, and only 30% of all of those who make the first contact are referred to someplace else because they're unable to address the challenges of that experience at the time. So that's one. And the other is ZocDocs, which is a doctor reservation service. You just go on the computer and you can find a doctor within 24 hours in your area. And, these are just services that would have never been possible 5 years ago. But because of health IT and data management and the extraordinary new applications of technology, and those are just a few, our entire alliance, every single member has an enormous array of examples of how they're applying this new technology to improve access. And I would say, in large measure, the biggest winners are those who have been underserved in the past. And so I'm encouraged by that, but yet I still think soberly about how much we've got to do if we're going to make this right. I would say it on a scale of 1 to 100, we're probably at a 5 right now. We've got 95 points yet to go to get to 100. So we've got a long way to go. Krista?
I just want to add, one of our big goals is to build a coalition in Congress that includes more than just rural lawmakers, because as you know, in the past, telemedicine has been a very rural-focused issue. And if we're going to really get something done, we need to have urban and suburban representatives understanding how telemedicine can actually serve underserved people in urban and suburban areas. So to the extent that this study can focus on underserved populations in urban and suburban areas, it would be very helpful because we need champions. We have longtime champions from rural states. Now we need to develop some champions from other states. In fact, Cory Booker, we were in his office recently. He doesn't have a single rural county in New Jersey, but he loves telemedicine. So anything you can do to help us make those cases to those members would be very useful.
Good.
So I guess I'll go next.
Okay.
I want to thank you so much, Senator, for joining us today. And I bring greetings from Dr. Satcher, David Satcher, who holds you in high esteem, and from our our president, Dr. Valerie Montgomery Rice, who's the first female president of Morehouse. So again, want to thank you so much for everything. I know for many of us in this room, going back throughout the years, it is because of your leadership why this issue of health equity was elevated tremendously in policy. So kudos to you and thank you for all the work that you've been doing for our communities. I guess my question is, coming from the South, as you know, from Georgia, interested in learning about what you all are doing in terms of reaching out in the South and hitting those markets. So, and I'd love to talk about possible collaboration with us and the NHIT.
Well, that's a great question. Morehouse is such a good school, and I'm so impressed by what Dr. Satcher and others have done in recent years to not only maintain but to even elevate the stature even higher. I think the most important thing that we've done, and Trent Lott being from Mississippi and John Breaux from Louisiana probably have greater understanding of the challenges we face in the South than almost anybody I know, and they're passionately committed to this. But what we find is that these issues really aren't as regional as one might think. I mean, the same problems that we're having in Mississippi and Louisiana and Georgia and South Carolina are the ones we're having in South Dakota, North Dakota, and Minnesota as well. And I think so. There are nuanced differences with regard to the way care is provided and how we look at it and what priority it has. But by and large, these are national issues that I think we ought to think of nationally and do all that we can to involve people at the local level I would say to acquire a better understanding of what potential there is for answers to the challenges we faced in health for so long. We've dealt with these things for so long. People do think it's impossible to change them, but it really is possible now. Big data will have downsides, but it will have a lot of upsides. And health IT applications are the best example, I think, of what that could mean for all of us. So I'm excited, but what I think we have to do is do an even better job of connecting, of bringing people to a better understanding, and then really creating kind of a consensus nationally that this is something we've got to do. And the sooner we get it done, the better. Sylvia Burwell and I have talked about this on more than one occasion, and she really wants to be as engaged and committed and supportive as she can be. So I'm very hopeful that in the next couple of years, we can move this needle. And it's organizations like yours and our collaboration with you that it could really make a difference.
We unfortunately need to respect the Senator's time. And Senator, I would really want to thank you on behalf of the collaborator for being here with us and being so gracious with your time, being so supportive. And Krista, thank you so much for all your leadership. And I can assure you that we will be reaching out to you on this report, and we would love to collaborate with the Alliance in making sure that this is a joint effort as we move forward.
Well, thank you very much. I have enjoyed it very much, and I hope this is the first of many opportunities that we can have to get together and compare notes and to talk about our mutual agenda. But thank you all.
Thank you.